Doctor, thank you so much for coming in. Just to clarify,
Pleasure.
to everybody who's watching, you are a public health researcher. Is that how I would want you to kind of be?
Yeah, so in terms of what I've done, is in I've done a lot. I've taught a bunch of things, a lot of it regarding community medicine and public health. But I've dabbled in philosophy. I've taught a couple of philosophy semesters here and there. But at the moment, my main work is on health systems research.
Hmm.
But that's completely so. With regard to health systems research, we're looking at various government programs and seeing how well they're performing and how we can optimize them.
Okay, yeah. And right now, I mean, it's a very, very weird time, to say the least. First of all, I just want to ask you, like, did you see this coming in a way? Like, did you think that there would come a point where we'd be facing something similar to a global health pandemic that would be spread all across the world?
Everyone in the field did. So I may be getting the time frame a little wrong, but there had been scenarios where, as in simulated scenarios, wherein with a group of professionals, they created this case study and saw how responses, etc., are developed. And I was attending a short course with a CDC affiliated body over here, and they showed us this film, I think Pandemic, in which basically a very similar disease was spreading.
Yeah.
And to a very large extent, even in terms of how it developed and how it spread and its propagation and everything, pretty similar to what we're seeing. Aside from this, there have been like various epidemics and pandemics in the past as well.
Yeah.
So we're not exactly in unseen territory. Yeah, it's unseen for us, but not for, if you take the broader lens of human history.
Yeah. And I mean, like, there was SARS and MERS that was pretty, like, recent, so to speak. Like, I want to talk to you about the Spanish flu in a bit, but that happened, right? And I think the overall consensus right now is that nobody really gave a fuck after that happened, to try to kind of expand this problem, which we saw in SARS and MERS, and assume that this can spread to a much larger level. Is that characterization true, that a lot of people were ignorant, so to speak, of the potentiality of how this can spread to other parts of the world?
No, not really. As in, various organizations have created various surveillance mechanisms in a lot of these places. CDC in particular has been doing a lot of work in this region, Pakistan included. And even if you look at how countries have responded, countries where SARS had been a major epidemic had taken, they were a lot faster in terms of their response in comparison to countries which hadn't seen SARS. So yeah, lessons were learned, but to a large extent, it's also a consequence of globalization in terms of how people are traveling. It's a disease with an asymptomatic period. As an asymptomatic, meaning that you're not developing any symptoms, that you could be transmitting it without having any symptoms, not knowing that you're infected with it. So there's several circumstances that kind of come together and kind of converge together to make this into the disease that it is, and has resulted in it spreading. And I think that maybe we wouldn't be remiss to keep in mind that there are diseases that are far worse than COVID. But maybe they've not become pandemics because they're killing people a lot faster compared to how fast COVID is killing people. Or they're killing a very large number of people compared to how many people are being killed by COVID.
Right.
So the way that infectious diseases works is that you need to have someone susceptible to transmit it to. And, you need to be healthy enough to be transmitting it. You need to be normal enough that, the person doesn't immediately see you bleeding out of your eyes, and they start to run away from you. So all of these different factors, as well as the fact that this is a new coronavirus.
Yeah.
So within coronaviruses, there are two broad types. There's the alphas and then there's the betas.
Right.
As in there are
Sounds familiar.
yes, just like real life.
Yeah.
And this is among human coronaviruses that there's alphas and betas. But if you look at the overall animal kingdom, there's a lot more, as in it goes all the way up to gamma.
Really?
There's four types, yeah.
But this one also came from an animal, right?
Yes. So when they did genetic testing on it, they found that it was, I think, 96% homologous to a species of coronaviruses that are found in bats.
Right.
As to whether it's the same thing that came from bats.
So there's some truth to that. The bats thing.
Yeah, not the bat soup joke has an interesting thing going on with it as well. So this travel logger kind of went to some area in China and ate a bat. As one does. You go to a place, you eat weird food, you come home, you laugh, you tell people about it. And this was a long time before COVID was a thing, but she eventually contracted the disease and everyone was like, she ate a bat, therefore that must be why.
So on the last point though, about certain people or certain organizations taking effective measures against it when people in, your circles knew that it was going to be a problem if something like this happened. So I don't know if you've heard, but there was a report published recently about the UK government in which they said that over the last couple of years, I think it was in 2017 or 2018, health experts told them repeatedly that they did not have the requisite PPEs. They did not have the requisite equipment or the requisite or the required, the capacity needed to, effectively cater to something like this or, prepare for something like this. But people at the top didn't pay much attention to it. And this is something that you saw in the US as well. So while you have organizations like CDC working, you also have a large amount of, apathetic behavior towards something like this by the people who actually call the shots. Would you agree?
It's complicated, as in, something else about me. I have a master's degree in bioethics, and this is basically a 101 within it, is that whenever you're talking about finite resources, it is by its very nature finite, and there's always going to be some form of a deficiency or the other. And some of that deficiency comes from, for example, with ventilators, it comes to spacing issues in hospitals. And with regard to personal protective equipment, yes, no doubt more can be done and more should have been done. But you also have to keep in mind what the supply chains are with regard to production of this equipment. So, for example, with the early days of the COVID pandemic, at that time just an epidemic in various parts of the countries, there are a lot of concerns raised about who is it that's making masks, who is making the base compounds for, everyday drugs like paracetamol or by the trade name Panadol or, these kinds of drugs, acetaminophen in our Greek.
Yeah. Our Greek, yeah.
Supply chains have been interrupted, transport has been interrupted. So to what extent can one say that, policymakers are at fault or XYZ person is at fault? Because if we're talking about the COVID pandemic, we also have to think about all the diseases that did not reach pandemic status. No one thanks the field for that. We just talk about the failures. And obviously, we have to engage in thought and corrective and preventative action as to why this particular disease slipped through the cracks. Probably because of the asymptomatic period, maybe, its mortality rate is far lower than SARS or MERS or Ebola, which was also something that there were concerns might reach pandemic proportions. So I don't think we should rush to put blame, especially in a country like Pakistan where all of the borders are so porous.
Yeah.
That is basically how a lot of it did enter into the country. The index cases had come from abroad to perform their religious obligations. Yeah. They came to Pakistan and they didn't know they were carrying the disease when they landed
got turned
here.
Into a shit show as well.
Yeah, so there was a think tank report, sorry to cut you off, which I read about today, published in Dawn, they talked about it. And basically, the think tank report said that the Iranian pilgrims that contributed to the disease spreading more rapidly. So you're right, because of these borders and because of these pilgrims coming in, you couldn't just control it.
And that got turned into something completely different, like almost a sectarian issue. Like there's a lot of almost like mistrust right now, naturally, I think.
Man, whenever something happens, we always burn the witches first. Right. The only question is who's the witch in that particular scenario.
Yeah, exactly. And I think right now we are in a bit of a witch hunt. I mean, globally, right? Like there's a lot of... So I was reading this paper about Norway post-Spanish flu. But I think the interesting thing about that paper was the way they set it up, right? So they initially talked about a lot of things like the way disaster is framed. So disaster framing, they said, was an integral part in not just the disaster itself, so to speak, like, and how people can recover from it, but it goes into a deeper level of mistrust and kind of finding out who was behind the natural disaster, which is as comical as you might see. Like, people don't think of natural disasters as natural disasters when there is something which is like infectious, which was the thesis of the paper, that when in infectious diseases there's already going to be some level of mistrust between people because it's transmitted person to person. But now the natural course which led to that coming into the forefront. So COVID was a natural kind of a thing that just happened. Nobody manufactured, although that's a separate debate as well. But right now people are kind of... So Trump, Captain Dumbass, is pointing at China, calling it the Chinese virus. A lot of people here, like we were talking about, made it into a sectarian issue. So yeah, I mean, people are kind of on edge, and I think they will be, because of the way the disaster isn't really framed as a natural calamity or something which is not as a pandemic per se, but just as an infectious disease that's transmitted by other people. So stay the fuck away.
And that's a lot to unpack right there. So, first of all, with regard to natural disasters being natural and whether we frame it as purely a natural phenomena versus something caused by human activity, yeah, diseases like this are as a result of human activity, as in no doubt about it, but maybe not in terms of the way that we're thinking about it. So it's what's known as a zoonotic infection, and as the name implies, transmitted from an animal. And the fact is that in terms of the proximity of our food sources to wildlife, in terms of our consumption of actual wildlife itself, or merely the fact that we're bulldozing down forests and, encroaching upon those spaces, and as a result of our presence over there, we are exposing ourselves to these diseases. So, for example, with anthrax, outside of a human population, anthrax comes very often in lion populations across Africa, especially after droughts. So basically, the spores are present deep underground. There's a famine, not exactly a famine, but rather a drought. So soil becomes looser, starts blowing away, and the deeper soil that contains the anthrax spores then mobilizes. So it spreads to lions because the lions were there. Right. If humans were there, the humans would be experiencing an anthrax epidemic in that area. Same with Ebola, humans were present, ergo it transmitted. Same with this. So as to whether we can blame a particular region for it, if not China, it would have been somewhere else.
Yeah.
Like swine flu started from South America. Yeah. MERS started from the Middle East, thus the name Middle Eastern Syncytial Virus. Yeah. So I don't know if any particular group can be maybe blamed, but maybe the size of the human population, the way that we are interacting with our environment, the way we live.
Yeah. And, I think this is a very educated and nice way of saying Trump's an idiot, right? Essentially, because he's calling this the Chinese virus. And it's kind of like, you understand what he's
saying. Kung flu.
Wait, what? Did he say that?
Yeah, not Trump himself, but one of his...
Heck, God. Yeah.
No, but it was said by someone.
It was said by someone, as in...
the administration.
Someone in the administration.
It's on the record. Yep.
Kung flu? I'm sad I didn't think of that. That is brilliant.
come to think of it, I think Trump said it himself. And the reporter was like, "Oh, are you saying that to me because I'm Chinese or I'm Asian?" And it was just weird. And it was like, next, like he does.
This was a meme. Trump is very deep in on the meme game.
Really?
Because this was a meme far before anyone from the administration said it. And when they said it, I'm like, yes, I know which meme sites you guys are going through.
Trump is an idiot, man. But I mean,
I don't know, as in... politics isn't my expertise. He was voted in, and he's probably going to win again.
Sure.
Who's the idiot now? Is it him or
most of them? I would say are the idiots. Because like Heather, you're like, oh, actually, I might like think that there's a chance he doesn't get it. Like initially, I was also one of the guys who was like, oh no, for sure, iski 2 terms honi hai. Like he's gonna go through this one. But I feel as if he performed so poorly, like below everyone's expectations, to the extent that now it's going to force out every single Democrat in the country. Ke bhai isko nikalo yaar. Like I think it's gotten to that point.
We'll see in November.
Yeah.
That's all
But they have like a lot of people, at least from what I hear on podcasts and online, it's like, well, I'd rather vote for Trump than Biden because there's that demographic as well. Because you never know.
Yeah, white people have never let me down. So I don't know. Let's see what they do this time. Fucking idiots. But speaking of fucking idiots.
Trump.
Right. Specifically Trump. How do you think he's kind of... what do you think is the most interesting thing about the way his administration is handling it right now?
About Trump's administration specifically? I don't know. As in... He closed off the borders fairly early, which was a good thing.
Yeah.
But how well they're coping, I guess, is as well as anyone is coping.
Are you looking at the numbers?
I'm looking at the numbers
What
because...
did they tell you?
So, the numbers are interesting. So, for example, countries like Belgium have a higher mortality rate than Singapore. The mortality rate has, based on different countries, there's been a lot of variance behind it. The numbers I read basically just before coming here, Belgium was at 16% mortality rate and Singapore was at 0.2% mortality rate.
Wow.
The WHO estimates it to be about 3.2, whereas in China overall, it was 2.1%. In Wuhan, it was about 4. I feel like Zakir Naik just listing out all the numbers.
Just like it's a chapter.
Suffice it to say, there's a huge variation behind it.
Is it related to something like the average age of the population? What would you? Why is Belgium at 16%? Because we can see unless the virus is mutated or something like that. So what kind of causal links would you establish there?
So there's a lot of things associated with it. To start off with, some countries are conducting tests post-mortem as well. They're taking samples after a person has died. There's difference in terms of testing criteria, amount of tests that are available. Some countries are solely relying on numbers that are coming from hospitals. So when you're talking about something such as mortality rate, or even just crude mortality rates, then the numbers seem a lot more intuitive than they maybe actually are, because there's a lot of granularity that goes into it simply based on what are the numbers, how are you finding out the numbers. So in New York, for example, they did a very huge amount of testing. This group of researchers basically just went to a shopping mall and they tested about 15,000 people.
In a shopping mall?
In various shopping malls.
Okay.
As in not just one Walmart, 15,000 people.
What is the shopping mall? Like 15,000 people, yeah.
And they found that I think about 19% of New Yorkers had the antibody, which translates to numbers that are 10 times that of the number of recorded cases. So when you're looking at the numbers, there's a reason behind the huge variability to it. But the area of interest is definitely there are differences in resources as well as in demographics. So different countries have different percentages of people above the age of 60 or 70. These developed countries developed in like the old-fashioned sense of it.
Yeah.
Western Europe and the US.
Yeah.
They do have a higher percentage of elderly population compared to countries like ours. So that is possibly why you were seeing this much of a variance in the mortality rates or numbers of cases.
So one of the things that I take away from all that is, so you said the WHO states that it's somewhere around 3%, 3.2%. But like you said, when in New York they took a random sample of so many people, it turned out to be, a lot more people
10
had the
times
virus. So generally, I think numbers are going to be underreported vastly due to the nature of the disease itself. If I'm not wrong, a majority of people who contract the disease are asymptomatic. And that naturally means that they won't get tested unless they've been in contact with someone else or because of some other reason that they have to get tested. If they're just like us and they're at home and they get the disease, they won't know. And there are thousands of people like this because of the nature of the disease itself. So generally, because the number of cases are far greater than what are reported, the deaths, I would assume, are more or less what they are. The mortality rate automatically drops because of that's just how fractions work. The denominator increases vastly. So do you think that's one of the silver linings of this entire thing, that the mortality rate is even lower than what you're actually?
No. So another area of granularity that comes along with it is basically that when you're talking about death as a result of COVID-19, what deaths are you specifically talking about? Because some studies have found that hospital mortality rates have fallen, overall hospital mortality rates, that there are less deaths happening in hospitals. Now, one could either lean towards the optimistic thing that, a pandemic is happening, therefore doctors have buckled down, or what's actually happening, which is that people aren't going to hospitals. People aren't seeking medical care anymore because they're afraid of catching an infection from there. So there's a very large increase in numbers of other deaths as well as a result of a strained healthcare system. I was reading somewhere that they're expecting more deaths as a result of cancer and heart disease because people are not seeking timely care, or because of the lockdown, their medications were either not available or they were not able to go and buy the medications.
So yeah, basically even if they didn't have COVID in their system, they died because of the pandemic. Yeah. So naturally, so are they counting those? What do you think is happening?
No, so what they're reporting are the crude death rates, which is basically the number of people who have COVID, lab-confirmed COVID, over the number of people who are dying as a result of it. Other way around, sorry. The number dying divided by the number infected.
Right.
So in Pakistan, so I've heard, and obviously you can't really, there's no proper evidence to back this up, but what I've heard is that people are, like you said, afraid to go to hospitals and afraid to get tested because they're like, हमें आके बंद कर देंगे, हमारा घर सील कर देंगे, we're just gonna, sit tight. But then you said that if things go bad, they still don't rush to the hospital because they're scared. Even if they don't have COVID, they have other medical problems that need attention. They don't go. But don't you think when a person is on when it's a serious medical issue, even if it is COVID, and if a Pakistani doesn't take it seriously, but then gets breathing problems or develops pneumonia in both lungs, he naturally has to, because your survival instinct kicks in, or he's just like, मैं फिर भी घर ही रहूंगा.
A lot of people still stay at home.
I don't think you can answer that.
No, I can. As in, based on...
It's ridiculous though.
Based on a lot of things. So, for example, you're naturally assuming that everyone even has access to a hospital that they can go to. Transportation issues. The stay, as in, if you, let's say, have a sick relative and you live away from one of the major cities, you have to come to the city, you have to stay in the city, you're taking days off from work. Yeah. If you're a day laborer, that's directly lost income and everything like that. As in, there's a lot of reasons why people don't come to hospitals, and the state of their health is not really a factor it is a factor, but not as big a factor as one would hope that it is.
There's a lot of like not a lot of, but I think there's one drug that's being developed right now. I think Gilead made it, and this got licensed by 5 companies, if I'm not wrong. This is not a vaccine, obviously. This is
Remdesivir.
Sorry,
Remdesivir.
I don't know what it's called. I don't
Yeah,
know.
that's the one.
But yeah, it's what, a pain reliever essentially for people who are.
It's an antiviral.
I've explained.
And then there's also hydrochloroquine.
The hydrochloroquines.
See, I know this as
of,
pain reliever vaccine, and I don't know these terms, but yeah, there are drugs being made essentially, right?
Yeah, there are. So the hydrochloroquines we'll talk about in a bit. But remdesivir is an antiviral, which basically means that it kills virus.
Right.
Hydrochloroquine I'd been reading a lot about, but it kind of dropped out. I don't think it's as promising as initially, and no one is commenting about it until more solid research comes in as to whether or not it's effective. And I think it's irresponsible because you can go and buy a hydrochloroquine just from your everyday market.
Yeah,
so
it's an anti-malarial.
It's an anti-malarial. So everyone was stocking up on toilet paper and sanitizer. So everyone's also concerned that
hydrochloroquine. Trump started taking it, by the way. Did you guys know he started taking it himself?
I heard some people took it on his advice, like him advising, and they died. Didn't that happen?
But they took the wrong time. There was something like
them
this.
drinking bleach, wasn't it?
What? Oh, yeah, that happened too. Yeah,
that happened.
There's a lot of shit, like crazy, like stuff people would normally like. How can I understand, like, this is really tough for a lot of people, and I understand, like, the worry is dispersed based on what kind of a person you are, right? Like, if you're really paranoid, like I am, like, you'll be, like, very, like, kind of uptight about, like, what you're doing, you know what I mean? Like, but then, how can you come to a point as a person where you're like, here's some bleach, right? I'm gonna drink this, and I'm fixed. Like, how do you possibly?
Are you questioning their right to drink bleach?
No.
Is there an amendment right for this? Yeah,
man. If you like take a broader lens of history, as in all of this has been done so many times. So these days we have the internet to spread misinformation. Back in the day, they had the Gutenberg Press.
What? What the fuck's the Gutenberg Press? I don't know.
Dude, as in when they first started printing paper, everyone was printing pamphlets to sell whatever junk it is that they were selling.
Yeah.
And, there was a huge surge in publications where people had these printing presses in their house and they were writing their conspiracy theories and then standing in the street corner and distributing it.
What?
Yeah, so we've been doing...
Like the town, like this, like the guys...
So Eddie Bravo was not the first one?
What?
Yeah, so it's
Fuck
been...
Eddie Bravo, like, you know what I mean? Like, wow, I didn't know this.
So during the cholera epidemic in particular, as in this was in 1854, in London there was a huge epidemic of cholera, and that in of itself is a wild ride, and maybe we'll talk about it at some point. But people were like selling all sorts of homemade remedies, including various narcotics.
My God.
So yeah, you're dying, but at least you
at least
died.
you're tripping out while you're doing it. It's like, oh my God.
I know they weren't tripping; they were on morphine, as in.
When you said other kinds of drugs, I just thought
cocaine and morphine mixed together. Which one is more? Time will tell.
There's speaking of things that might or might not heal you or cure this. Apparently in Ghana they found a plant which they're claiming cures COVID. It's Artemisia annua, or sweet wormwood, which is apparently what they found. And the president of Ghana is claiming that this is gonna fix it, right? Kind of dumb if you think about it initially. Could be the one, you know what I mean, that we've been waiting for.
Plant?
Yeah, I don't know. A plant could fix it. Why?
No, I'm just saying it's saying that the plant.
Some compound in the plant probably.
Yeah. So like there's that. But again, I don't think I don't understand why presidents are making it a point to like this guy and then Trump to like kind of like what makes them wanna say try this.
Man, because everyone is scared and there's no real guidebook as to how politicians are supposed to behave and in general how health communication is supposed to take place. And the fear is like just and everything, and it is a major political issue. It's an economic issue, it's a political issue, and so I read this article back a while ago, and what it did was that it credited a lot of workers' rights to the bubonic plague because all of a sudden there were less workers. So whenever there has been something along these lines, a major disruption that comes externally, be it in the form of a pandemic, be it in the form of a war, it's led to major changes. And as to what direction those changes are going to take, whether or not we're all going to kill the bourgeoisie in the streets, let's see, time will tell.
No.
You're part of the bourgeoisie, man.
Huh?
Part of the bourgeoisie.
Man, look at this dank den, as in,
This is a spare room.
You sure need your workers' rights.
Anyway, I don't know how I'm supposed to address my privilege. Yeah, I know it's there. And sure, okay. I did pretend to be a Marxist. Just to clarify.
Let's not go.
I'm not giving this shit up. That's all I'm gonna say. Like, anyway, yeah, you were saying. We might kill the bourgeoisie. Yeah.
Isn't it? See the way that, as in, we don't know what's going to come up, what kind of disruptions are going to come up. So I misquoted with regard to cancer before. So in between the 2008 to 2010 economic recession, they found a very sizable increase in cancer mortality rates. Mm-hmm. And this is just like within 1 month of the pandemic, 3-4 months of the pandemic, being the new reality, we are seeing like the global economy start to crumble.
Yeah.
I was reading this report that said about 6.9 million Pakistanis are facing, as in specifically with regard to the cost of food, they're not able to keep it up. They're reducing the number of meals or sizes of meals. Mm-hmm. And I think 10% of respondents in this study said that they remain hungry so that the rest of their family can eat. Wow. So times are tough. And this is, again, just very early days, and we don't know how long. As in, a lot of different models are saying that maybe at least until December we're going to go through this kind of difficulty, but might extend until next year, or this might actually be the new normal. We don't know.
Remember when people were saying, hey, can't wait till April when this goes away. Like that was when this started in March, people were saying April the vaccine bun jayega.
The government ne yahi kiya, bro. Bahut ho gayi hai, chalo.
Wishful thinking, because the SARS epidemic had reduced in the hot months, basically around June, July, August. So and because the number of cases had dipped, and because this current COVID pandemic is, the germ that causes it is related to the SARS virus, that's why people assumed that it would behave in the same way. But at the time, everyone was, as in speaking as someone who has friends and family that have like a lot of questions about the current pandemic, everyone was coming up and saying, won't it reduce in June, July? And at that time, I was just saying, we don't know. Yeah. I'm glad that was the response of the medical community, because we didn't know then, and it's not panning out to be the case. Right. And that's maybe where the next important part of health communication comes in, is being willing to acknowledge when you don't know something, and in terms of whether or not Trump is even humanly capable of making such an admission, or even if it's wise for a head of state to be making that admission. Like, if they're coming up on a national forum and saying, hey, we don't know anything about what's going on, but we're studying about it. Yeah. As in, it doesn't calm people down, and you need people to be a little less anxious in this already really anxious period of time.
Right. And, obviously, we're heading towards the inevitability of this ending or not, like, in one way or the other. Like, what I'm trying to take us to is a time when this is like, to an extent, it's kind of either dropped or this could be a year, 2 years. It could even be never, but let's assume it's a year, 2 years, or however long. The Spanish flu obviously must have changed things for the world after it had ended, and that's what I'm very curious about, like structures, and I'm talking about intergovernmental organizations and how they prioritize things.
It was called World War One.
No, but that wasn't necessarily caused by the Spanish flu. Like, of course, there was a restructuring after the World War One, but
No.
prior to the World War One,
Look at the time frames. As in,
Yeah,
Spanish
they do
flu
match,
was
yeah.
there in World War One, so there was already pretty widespread and massive destruction, and Spanish flu was just the cherry on top.
right? But wasn't there any kind of an assessment afterwards that अच्छा ये सब हुआ है, like the world, I guess what I'm logically thinking is the World War kind of overtook the need that people might have seen with the Spanish flu to want to maybe change stuff.
Also, with regard to the Spanish flu, there was a lot of laws with regard to what you could say, on a national forum.
Really?
And a lot with regard to Spanish flu was heavily censored. The reason why it's called the Spanish flu is not because it started in Spain, but because Spain didn't have those censorship laws. So everyone was like, oh, this new disease is spreading, but it's only in Spain.
Oh wow.
Yeah, it actually started in Kansas or the US somewhere, right?
Yeah, farm in Kansas, I think.
I don't know about that, but it started somewhere,
Yeah.
not necessarily in Spain.
All right. Right.
So generally about, like you said, this might go in December, it might not, we don't know. But we have to plan. So it's obviously, there's a caveat there that it's not sustainable for us to stay in lockdown for like a year, 2 years. Yeah. So how safe is safe basically? Is there a benchmark that you see? Acha, ab is point pe deaths pahunch gayi hain, is point pe aage, so we ease the lockdown? Because in countries where the curve has flattened, where it's gone down, like in Italy it's gone down. In New Zealand, I read in China today there were no new cases for the first time, but there's obviously a fear of a second wave, and it might come, and then you might go into lockdown again. So how do you proceed with? How do you live with it essentially? Like, what point do you say, "Bas, ab, what can you do? Kholo sab kuch."
And it's the new normal, I guess, as in, I don't know what else to say.
Yeah.
As in, we don't know what the world... So when we're talking about, when will things get back to normal, you're talking about maybe 2019? As in...
Yeah, well, what is normal
What's
now?
normal?
No, I'm not saying that. I'm saying at what point do governments or
They're already doing that though. They're already opening everything back up to where
A lot of places are out
here,
of economic
the
necessity.
US, like Georgia, was already in the news like 2 weeks ago for opening up. Brian Kemp, by the way, governor of Georgia, salute to you, fucking idiot. He opened up tattoo parlors, bowling alleys as essentials for the people. But anyway, you were saying, sorry.
Yeah, so I was saying that they've done that. So at most places they've done that once the cases and the deaths have tapered off. Because that's, the rest of that you had to flatten the curve. Let's suppose that a second wave does come in. Would they go into lockdown again? At what point do you decide, okay, we can't
I think that will have to do, and tell me if I'm wrong, like with the capacity building mechanisms that you can employ with the healthcare system. So if you can like build enough of a capacity that you can even if the mortality or even if the infection rate goes up to like maybe 70-80% or whatever, like if we have 100%, like if we can take care of 100% people infected, then 70-80 is not a problem. Is that correct?
Can you? I don't know how to respond to
like
that.
So capacity building, right? So if you
Uh-huh.
can build enough capacity to take care of people who are infected, then you'd probably be like, we can resume back.
Spanish flu killed 50 million, as in how much capacity are we talking about here?
that's
As
true.
in,
Like I guess like every country has
And
to-
one of the best healthcare systems in the world, Sweden, tried a herd immunity strategy, and उन्होंने predict किया था कि इतनी deaths होंगी, but it was like way more than what they predicted, and then they had to revert back to.
What do you think about herd immunity? Like,
herd
is it-
immunity is a really established concept. So it's this terminology is borrowed from vaccine sciences. So the idea is basically, as I discussed earlier, for the infection process to kind of take place, it has to transmit.
Right.
it has to transmit from an infectious person through some medium and then reach the susceptible person, with or without some intermediary animals such as, mosquitoes and stuff. But this is basically the principle for all infectious diseases. It's called the epidemiological triad. So the way that it works then within this model is I'm infectious, you're susceptible, I spread it to you.
Right.
But if you've had it before, at least based on the information that we have so far, is that you're developing an immune response against it, so you're not susceptible to another infection.
Time, yeah.
So let's say that I'm infectious, you've never had it, and you've had it before. This means that instead of me spreading it to 2 people, I'm just spreading it to 1 person. And when you reach a certain percentage of people who are no longer susceptible to the disease does not progress as rapidly as it had. Right. So the idea then is that if a certain percentage, at the very least above 60%, but more likely about 80-90%, if 80-90% of the people have antibodies against it, it will not transmit in the same fashion that it is transmitting now. But what's the human cost of 70% of the population catching it?
Yeah,
we don't know.
A lot of people going to die. And that's what I was going to ask. Like, this is essentially like the healthcare community's attack is the best kind of defense, almost. Like, we have to figure out a way to make sure that we can fix it once somebody has it. But what if everybody gets it? You know what I mean? Then we're not risking anyone. But that means a significant portion of those people are gonna.
Yeah, so you're basically saying that we're going to kill off. Like we're okay with the 2% mortality. We're okay if 5 million log mar rahe hain.
How do you make that decision as a society? Like, हाँ हम लोग ये करने लगे हैं. Like Norway में हुआ है.
It's simple cost benefit though. They were like it's far more benefit for the greater good if we approach that strategy. इतने लोगों ने मरना ही है. Where we can take care of the rest and let's just go with it. But it's weird for a country like Pakistan with no, like he said, people can't access a hospital. Yeah. People, there's no proper medical response developed nationally. Yeah, and then they've still decided to go for it apparently.
We have a national response, but as to how cost effective it is or how efficacious it is, time will tell. Because again, early days of the pandemic, we still have a long period of time to go, and maybe a lot of this would be easier to discuss with the benefit of 2020 hindsight.
2020 hindsight. I see what you did there.
I don't. That's nice. Nice. Should we talk about the elephant in the room, the conspiracy?
Right. So yeah, and before that, I just wanna. Okay, so I'm going to lay down something for you and you tell me if I'm right or wrong, okay? I think that in cases or scenarios such as a pandemic where it's a threat to a lot of people with infectious, blah, 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 I think people who might be spreading misinformation with regards to, how this started, how it spreads, how important or unimportant it is, or whether it's real or not real. If the government says it's real, then you say it's real, and nobody can say anything about there can be no conspiracy theorists because it's dangerous. That's what I at least want to think of it. And this goes back to the thing of framing the disaster and stuff and all of that. That should be left in the hands. And when I say government, I don't mean the government. I mean the healthcare professionals that work within the government should decide purely who can say what about this pandemic. And it's clearly you're stripping people's rights to express and say things and sure. But I think it's absolutely ridiculous to deny that this is a real problem, because people are dying, literally trying to prevent this from spreading. So it's completely dangerous, and this can spread to a mufti. This can spread to a fucking guy in Switzerland who has his own conspiracy theory podcast. I don't give a fuck. Whoever's saying that this isn't real, silence.
But listen though, how are you going to
who gives a shit? The practicality.
No, it does. But if everyone's out in outside and like, we don't care, we're not going to follow any SOPs, we're not going to wear a mask. Literally, log keh rahe hain government ki sazish hai because they want to
Mark
get
of the devil,
off.
according to a lot of memes on far right sites.
They're like IMF ke loans unhone qarze utarwane, that's why they're doing this. We don't believe it. How are you going to stop people from...
I'm saying people who say this stuff should not be allowed to say it.
Again, a lot to unpack.
Yes.
So to start off with, are conspiracy theories, all conspiracy theories necessarily invalid? Maybe not. Because, for example, Edward Snowden and PRISM, for years, people in tinfoil hats had been saying, hey, the government's listening to you. And the government was like, no, we're not. And suddenly they're like, oh, J. Edgar Hoover was. Oh, Richard Nixon was. Oh, Bush and Obama arguably were, as in this technology was out there.
Yeah.
So as to whether or not we should never make a statement that goes against the government.
No, I agree.
As in, we don't know. And
whether
whether
specifically
or not...
in a pandemic situation. Like normally conspiracy theories are important to understand. Like
but in the face of this one, so if you silence people in some way or the other, voices do come out. How do those voices come out? So, for example, during the Ebola epidemic, I think this was in Liberia, there was a quarantine camp for Ebola. Now, Ebola, thank God it's COVID and not Ebola. That's the pandemic at the moment.
Right, yeah.
Ebola is like a mortality rate of closer to 60% than it is to 3%.
But it'd be easier to control, though. And I think that's what was true for Ebola and all these other diseases in Africa, like not Africa. I was thinking MERS is Middle East is Africa. Never mind. What I'm saying is these diseases, epidemics to come before are so fatal that there's no chance that you can spread it to somebody else because immediately somebody can tell, holy shit, you're dying, right? So, but yeah, no, you were saying.
As in your little tirade, as in I kind of lost what were we talking about.
We were talking about
conspiracy theories, silencing them.
Monrovia, yeah. So what happened was that there was a quarantine camp for Ebola. Everyone was like, this is a government torture cell where they're silencing political dissidents. They raided it, freed all of the suspected Ebola cases, and stole mattresses, some of which had blood on it.
Why?
Because, as in you...
Because might as well steal a mattress.
As in, yeah, you're already breaking into a quarantine camp. Yeah. And if there's nothing else other than a mattress, what else are you going to steal?
No, I thought maybe it had something to do with DNA or...
No.
Those, sorry,
those mattresses ended up on the black market.
Really?
Yeah, because they were like, okay, let's make some money. And that was the only thing that they could steal and sell. So,
nice. Okay. Anyway.
Blood-soaked mattresses potentially carrying the disease particles, as in those made their way out into the general public.
Yeah, that's the big
How
problem.
Fantastic.
Yeah.
But generally, like you were saying, why don't you silence... So the government should silence these. But for conspiracy nuts, it would just prove I'm not saying it would actually. It would be like, देखा ये तो हमें बोलने नहीं दे रहे. They don't want you to hear. You can perfectly, reasonably imagine someone like Eddie Bravo or Alex Jones coming on and saying, look, they don't want you to know.
I mean, that would be...
You're from a part of the world where people suddenly vanish.
Yeah. So, I mean, what do you...
But as in, let's say...
They can do it. They can... Don't...
I know they can do it here. But how...
Are you saying no one vanishes anywhere else in the world other than in Pakistan?
How many people are they going to vanish, though?
Bro. Let's not get into this.
Let's see. Nazi Germany, how many people vanished? 2 million people?
They didn't vanish. Everyone knew where they were.
After the fact.
You don't have a trace of them.
As in, no. If you look at, for example, okay, that was very off the bat, but let's say, what about the Soviet Union? A lot of people vanished there.
Oh my God.
Or let's say even during the Tsarist times, a lot of people have been vanishing since the beginning of time, dude. It's not a problem.
We've been digging people up like 3 years ago. So this guy, the murder.
That union leader that they dug up who died 40, 50 years ago. They're like, oh, ye boy, tu yahan hai.
Found him. He's over here. But yeah.
Are we going down that
No,
road?
let's not.
Let's not, because
Yeah, it's completely irrelevant.
we are also like susceptible,
Right, exactly.
both to COVID and to vanishing.
Right. But see, this is where your argument wins, because if somebody's gonna do that to us, then people will be like, fuck, they talked about it, where are they now?
Yeah, exactly. So it all feeds into it.
If I vanish, it was
It was me.
If you don't see another podcast again,
It was us. It was us. But no, like I wanna. So I feel like we're getting into this conspiracy realm in the wrong way. I want to ask you: are there any that you have seen or thought of yourself, or ones that really interest you to like really look into?
Oh, so you're asking me to come up with conspiracy
Yeah. So
theories?
I basically talked about how people who talk about this shit shouldn't be allowed to say it, and now
And
I'm
now you're
asking him
asking-
to give me one. Yeah.
and now you're.
No, but this is all like, we know this is bullshit. Like for fuck. No, okay. Here's a
So
here's a disclaimer. On the mic believes that the virus is real. Stay the fuck home. Yeah, sorry.
Okay, so two conspiracy theories, that one that I've come across and one that I've come up with. First, the one that I've come across is that it is basically an invention in some lab, that it's a bioweapon that got out of control, basically.
Yes.
As to whether it was developed by the US or China, they're both accusing each other, because after that whole Kung Flu thing, basically China retorted by saying that it was the US Army that spread it in China. But this kind of stuff happens, as in viruses do come up, and a lot of viruses kind of do mutate, and we're seeing like natural selection kind of happen on a very regular basis.
Yeah.
For instance, there was some experiment in which they had cryogenically frozen some bacterial samples in the 60s or that kind of time frame. And then they compared that old sample with the current samples, and they found, even within the same strain of microorganisms, there is very huge genetic differences and huge differences in their mortality rates. So this is not exactly something that's unknown to happen. And it's the reason why you get influenza vaccines every year, because the influenza virus does change on the regular.
Yeah.
So
But that does it itself, right? It's not genetically or like manipulated.
It does it itself without manipulation, it's Jurassic Park, life finds a way.
Yeah, essentially. Yeah.
So I don't know, as in, obviously I cannot definitively say no, this was not, because no one can, as in, that's the nature of conspiracy theories. A lot of them are unfalsifiable, no matter what kind of evidence it is.
True.
But is genetic manipulation by evil organization necessary for a disease like this to come up? No.
Right.
Is it necessary? No. And if it's not necessary, then why do we immediately jump onto that bandwagon?
Yeah, exactly.
Now, my theory is that it's really convoluted, but from the deepest, darkest trenches of my mind is that
I've been waiting for this. Yeah.
aliens.
Really?
So be it aliens, be it lizard people, be it insidious organizations, RFID chipping through antibodies that your body develops itself. I think that's fantastic. I think that if this actually turns out to be true, it'd be awesome.
What exactly? How are aliens involved? Sorry.
He's like so confused.
No, but who is it that's tracking? Is it the alien? Is it the lizard people? We don't know.
Yeah.
We don't. Who's tracking what?
Exactly.
What is being tracked?
Yeah.
Us.
Yeah, us. All of us.
All right.
What do you think they're making, man? What do you think they're making?
Who is
They're
they?
making a vaccine? You think these people are actually dying? Huh?
Man, we follow Harry Potter rules. He who will not be named.
Batana nahi hai. This is the conspiracy theory. We're not gonna fucking tell you what it is.
Yeah. You have to pay an extra $5 for that information.
Click the link below and you can...
We should start doing that.
Hit subscribe.
Yes, that thank you. We were going to ask you to say that at the end anyway.
Fuck off.
No, we won't.
I'm not your show.
But generally, do you think people have started gravitating towards these conspiracies and this mistrust of authority and governments in recent times, or has it always?
It's always been the case. As in, if you look at polio vaccinators getting shot in Pakistan, as in a lot of it, and it stems from something as well, because what are their accusations? That whatever these drugs are interfering with fertility, that they contain haram products, and these tropes have been there since, for example, the Enfield Rifle Act. This mistrust towards institutions has been there for a long time, and it's not going to go away. So if you look at a lot of the health communication that is happening, it's happening in English.
Yeah.
And it's happening by people who are, even if they are indigenous, so, if it is a Punjabi who is speaking about it in Punjab, necessarily belongs to a different socioeconomic background, different education level, not necessarily someone who's really connected to the community in the same way that other members of the community are.
Right.
Whether or not community stakeholders are really taken on board when coming up with policies. So, for example, I was reading about this a while ago. There was a study in which they had given health information to African American barber shops, because they noticed that a lot of African Americans in these specific communities were hanging out at the barber shop. It was not just a place to get a haircut.
Yeah, there's been a cultural aspect to an African American barbershop, like the conversation, the camaraderie. It's all the same people you see every time you're there. Yeah.
So this is just my presumption based on what I read and what media I've been exposed to. I don't know whether or not it is like that on the ground.
I've been to like a few when I was in
Perfect.
Georgia. It's exactly like.
So what they did was that as a result of this targeting, they noticed that health information had spread to a very large extent. But we're not seeing that kind of thing happening with regard to COVID. It's a top-down approach that's being taken, as opposed to something that's starting from the grassroots and moving up. If you're not taking your stakeholders on board, how are you going to expect to come up with effective policy? And this isn't like a condemnation against anyone, because very plain and simple, I'm also someone who works in the field. Yeah. I've done like data related work. I've conducted qualitative interviews in the field, things along those lines, supervised research, blah, blah, blah. I've been about is what I'm trying to say. But it's not happening because of the lockdown. A lot of community related work has necessarily come to a standstill because everyone is afraid for their lives. Yeah. And as to whether it's as essential as a hospital worker, maybe research is not all the way up there. Maybe it should be, but it's not, and it's tough.
Yeah, it is tough.
Because even if you're like in charge of hiring people, would you necessarily want to hire people knowing that not just might they get sick, but they might also be carriers who are disseminating it door to door?
Yeah. Literally door to door.
I'm looking at you, Food Panda. Endorse us now.
I feel like that's ridiculous as well. Like health researchers can't go door to door to collect stuff.
No, I'm not saying health researchers can't, but I'm saying that
they might be.
What do you define as essential work within all of it? Yeah. How willing are you to put your employees into that if they're not like traditional healthcare workers?
Right. Yeah. It is a problem, but
there is good field work happening, I'm not going to deny that completely,
yeah,
but
course.
Things have like taken a slight back step.
And I think people would be hesitant to answer the door to maybe like somebody who's here to take some questions down or whatever, like polling or research or whatever it is, as opposed to like a lot of people are comfortable ordering food, going about their business. It's crazy. I feel like there's a, like you're saying, like there's a mischaracterization of what is essential.
There's a lot of communities that are really sweet, though, as in you go there to ask them a couple of questions and you end up drinking tea and having a laugh, as in it's really wholesome.
Yeah. You've done that a lot, like your research, right?
People are nice, but as in, aside from the ethical aspect that you don't drink tea with them, you don't be friends with them because that's not cool either. You're a stranger to the community.
Right.
But there are a lot of difficulties with regard to research at the moment, health research in particular, as a result of the pandemic.
Right. And you mentioned cholera, and I want to hear about that in comparison to what's happening right now. What do you think is the most interesting, I would say, similarity, dissimilarity, or just generally because you wanted to speak about cholera a lot, you mentioned it a bunch of times that we've spoken in the last few weeks or whatever. So what is it about it that makes you? What is it that tickles your pick? I'm not gonna.
Not tickles my pickle.
I was
cholera doesn't tickle my pickle.
But yeah.
As in, if you look at the history of cholera, it started off in this part of the world, the Indian subcontinent. It became a very major epidemic in London, and it was our strain that made its way there. As in, they gave us colonialism, we gave them cholera. Seems like a good trade-off.
Yeah, seems okay.
And as in, all of a sudden, it found the perfect population in 1854 London. Because apparently the toilet was invented before the drainage system. So, compared to peeing and pooping in a jar and just throwing that into the cesspit versus the whole cistern of water flushing everything down into a pond near you, as in, and one that may contaminate, and it actually did contaminate the water source. And it contaminated the water source in London in the form of a hand pump. And apparently the sweetest tasting water in all of London, because everyone was mad for that.
Are you serious?
Yeah.
That was cholera water.
That was cholera water.
That was shit water.
They didn't know that at the time.
Tasted pretty good.
It didn't just taste...
Where is this going? Yeah.
No, so, have you had diarrhea before, either of you? In your entire lives?
I guess, yeah.
What do you mean you guess?
Yeah.
As in high probability, it was a result of eating some amount of fecal matter.
Is that what?
Yeah, a lot of diarrheal diseases are spread through the fecal-oral route, as is polio.
Wait, so I ate shit.
Yeah,
you got the shit.
Some form or size.
In all probability, you're eating shit on the regular.
On the reg? I didn't know this.
What do you know about, your water or your food sources or that random fly that sat on the thing that you were eating? You don't know where that fly's been. You don't know its story.
I feel story. I feel like I started this podcast being the guy saying anyone who has a conspiracy theory, go to hell. Now I'm like, man, I can't trust anything.
What do you mean? This is normal. This is...
I'm sorry.
Yes.
No one's been feeding you shit. It's just how it works.
It doesn't take, you sitting with a spoon that this is chocolate ice cream. That's not how it works. You just need the germ particles.
It's got ice cream today.
No one's planted that shit. It just happens.
Shit happens.
Shit happens. And it's as a result of having very dense urban populations who are drinking the same shitty water supply. Oh. So kind of a perfect set of circumstances that are coming together. And those set of circumstances are why the disease is transmitting to the extent that it is.
It's the same thing right now.
It's the same thing right now.
So it was the fact that they made toilet before drainage system that made cholera happen. Right now it's the fact that we have planes and trains and cars
and planes, trains and automobiles.
Yeah, and grocery stores that can fit 15,000 people wherever, and then all of this stuff, which I guess we've been living a certain way.
Even if you look at how work is, depending on what kind of work you're doing, the nature of cubicles and the 1 hour lunch where you're sitting with all of your co-workers and having a good old laugh, or the way that, in general, the way that as a species our family structures are, the way that our social networks, etc. are, and even just how densely populated we have become. As in, if you look at the cities that are, and I'm not talking about countries, but if you break it down to a city-wise kind of distribution. In Pakistan, it's Karachi, Lahore, Islamabad. In America, I'll ask you, which city do you... New York. Most densely populated city, or among the more densely populated cities, rather.
So, and then you can tell, like, that's exactly where it's happening. But do you think this is going to change how we live our life? Like, obviously, we've tried pondering over this question of what's going to happen after. But this has got to have some kind of an effect when it comes to how we kind of organize or live as a species.
Oh, by the way, sorry, before I answer that, so the way that we were talking about people drinking shitty water or eating shitty food,
yes,
in the same way, like the problem with handshaking, my snot is coming onto your hand and you're rubbing your eyes with that very same hand. So
I swear, man, like
I used to think I was pretty clean.
As in, aside from the fact that we have a huge amount of microorganisms that belong on us, as in they belong on our skin, in our mouths, in our gastrointestinal tract.
yeah.
You know, like there's a microorganism in your large intestine that secretes vitamin K. If you're taking an antibiotic that kills that specific bacteria, you bleed to death. As in, the body is hilarious.
Probably something we shouldn't say on the first date.
Not stuff you say on the first date. No, definitely not. But talk to me about how you think we're gonna be after. Do you think there's certain aspects of, like you said, work or like even this shit? Because I feel like we're gonna have a generation of people that was already going through a really weird kind of, like, I don't know, like
We're looking at you, millennials.
yeah, literally.
All your podcast listeners.
No, I hope.
That's a stretch.
Well, I
Gen Z.
like, yeah, I mean, better than most of the shit kids are doing these days. I don't know. I hope so. Like, what the fuck is a TikTok? You know what I mean? Like,
Dude.
what?
Hating TikTok is...
TikToks are weird, man. Like, what is this? Like, what?
Okay, boomer.
No,
Okay, boomer.
it's like what? Like,
I don't have an opinion either way, but
no, it's bullshit. You know it is.
no, I've not experienced it. I've just seen some funny videos. I don't know how it works. It just happens in front of me.
Nice.
I just see the finished product.
That's the problem.
This is why you're going to be the first executed, because...
Me?
No, not you, as in...
Yeah.
Because, you know, it's only the bourgeoisie that are complaining about TikTok.
I swear, I read this somewhere. Hating on TikTok is a very classist thing.
Yeah.
And I don't even hate local TikTok. I think local TikToks are fucking hilarious. Like, like the water spitting out and the... Like, I dig that. What I hate is like if you go to like the more American and the more woo TikTok trends, which is just like cringy and
They might be
weird.
working class as well. You don't know.
I don't give a fuck what they are, man. Like, you know, no, this
poor
stuff,
people and their means of personal
it has nothing to
entertainment.
do with their means of whatever. Like,
Yeah.
I feel as if
Like, you can set up a podcast. They can't probably.
listen, as somebody who would want to be
We're gonna get cancelled any second now.
on the internet.
I had to explain to my grandfather what a podcast was. Can you imagine what that is like?
Yeah, no, I'm definitely going to be one of those people who's going to be like, what is this meow app? You know, like, because their names are devolving to like dumber and dumber shit as well. Like, we had Facebook, like my Orkut, MySpace. Holy shit, Orkut, MySpace. That's also going to be a reflex, by the way. Once this is over, it's like, oh fuck, somebody coughed. But that's Orkut, MySpace, Facebook, Snapchat, and now we're at TikTok. Like, what the fuck? Like, it's brainless is what my problem with it is. You know, it's just people are very...
Yeah, man, if it's not named Tesla, Daniyal has no interest. Yeah, man, you look like an Elon Musk fanboy.
If Elon Musk is on TikTok, he's signing up
You
for
need
that
to have
shit.
a high IQ to understand Rick and Morty, you see.
Oh my god, no, I'm not one of those people.
Dude, you
Nah, I
sound
totally am.
exactly like one of
I
those
sound
people.
like that, but my reservation specifically with the TikTok.
Yeah, okay.
That's the problem. Why is it
Also,
specifically for that mode of
There's another
communication?
reason. There was a lot of fucking...
Oh, by the way, since we're talking about TikTok, acknowledge the fact that a lot of really good content on COVID came out on TikTok. Arguably,
Oh, you got me.
Yeah.
Like what?
Man, prevention videos and stuff like that. As in, if you look,
Really?
if we're talking about the sources specific to the app that, have spread conspiracy theories, arguably Facebook is spreading more conspiracy theories than TikTok.
I didn't think of that. But like TikTok, that's the thing. TikTok can't spread information even if it tried. That's how dumb the app is. Because it's listen. I have a problem with the way the app, at least like the videos I've seen, look. That's it. I don't give a shit who's on it. I don't give a shit who's using it.
Then
Use it for.
Why don't you use it and show everyone else how to do it?
I did. I tried. It was the effects were really weird. They were all kind of monotonous. The aesthetic was strange.
So because you weren't very good at it, you decided to hate on it.
Okay, boomer.
I am gonna be one of those guys who's like, what the fuck is going on? This, that, the other. But yeah, I feel as if there's gonna be a lot of shit that's gonna change as time goes on and as we keep going about.
So speaking about boomers, as in this is going to be the effect of the COVID pandemic. Boomers going to die, unfortunately.
That's just,
so sad. Yeah, as in
that's what's
genuinely, it's a huge tragedy that if we're losing one of the greater generations. But then again, there's going to be a huge population explosion this year because everyone who's locked at home with nothing better to do is probably like procreating the way God intended. So it's like boomer out, boomer in.
Oh my God. Oh, so we can call these guys boomers too. The kids that are getting born right now.
You heard it here first, folks.
Hey, you heard it here on the mic. But no, that's interesting. And I think like, especially with contraception, how there's going to be a lot of boomer outs.
Instead of a guy here having 12 kids, he's going to have 24.
That's extremely problematic thing to say as well.
Feel bad for the missus, man, and she's doing the work.
Those stories really fuck with me as to how people can actually go through that. Man, I really, really, really miss this. I really miss talking to people in person. And it's like, like Zoom calls are great, especially for
TikTok isn't though.
Fuck TikTok, man. And fuck you.
And if we're gonna like randomly cuss out apps, I say fuck Zoom, man. Zoom has ruined my life.
I can't believe we've devolved to this.
छुट्टियां बना रहे होते Zoom ना होता. नहीं लेकिन Zoom,
but if it wasn't Zoom, it'd be something else.
Wow.
We're just cussing names now. Like we're not. Technology to aa chuki hai. Like it would be some other name.
But yeah, Doc, I'm really glad we got to do this. Before we close, is there anything that you thought that you want to talk about coming here and then you might have missed out because of the course of the conversation?
The conversation was fantastic.
I loved it.
Yeah.
Because I wanted to ask you beforehand, like I do with some guests, like we would talk about this. But man, honestly, this is why I wanted you on because it's so easy to talk to you.
I forgot. Stay at home if you can. And if you can't, wear a mask and wash your fucking hands.
लेकिन sir, Eid की shopping.
Glove mask पहन के करो.
नहीं, ना जाओ. Stay home. Well, natural selection.
Yeah, man. No, as in with the unemployment and shit that's happening, you should probably be saving your Eid money because you might be hungry tomorrow.
Yeah, even if you're one of those idiots who's going around Lahore on a bike with a Land Cruiser behind you, your daddy might have to sell that Land Cruiser in 2 months. So don't go for Eid shopping or any of that bullshit. Guys, by the time this is up,
they'll be fine.
I think it is bourgeoisie.
Yeah, I'm just letting my fellow bourgeois know.
But dude, I've had a look at your house. Now I know the schematic.
It's not a palace, first of all. It's just a regular.
But it's positively palatial compared to everyone else, dude.
Listen, I didn't do this, right? My dad did, and he's
classic.
Daddy. Daddy, our house is too big.
I can't do anything about it. I'm trying to.
I'm using all of it, and
at least that's, you know what I mean. Like I agree.
And shitting on TikTok.
Yeah, man. As in.
I agree. Listen, no.
You're shitting on daddy when you're living under daddy's roof. Your cave-dwelling ancestors are ashamed of you, bro. They're like, go hunt, go gather as soon as you're like 14.
I have a gym in my basement, so it's okay. I just work out at home. No, listen, I agree. All of what you're saying is correct. But Yeah, no, it's true. Like you guys are right. I don't know how to
Just sign off, man.
There's no ways. I'm not gonna sign off like this. No, there's no two ways about it. Yeah.
Kids, wash your hands. Don't blame daddy for your poor hygiene.
Exactly. What? Oh man, I really like this. Heather, I love you and thank you for doing this. Really appreciate it.
Is that it?
Yeah, that's it. No, the podcast isn't exactly over. Ladies and gentlemen, thanks for watching. All of us had a great time. Hope you had a great time listening. Please wash your hands and make sure you hit that subscribe button right after you wash your hands. and yeah, no, follow along for everything. I want to thank Heather one more time before we sign off. Thank you, Heather.
My pleasure, man. Thanks for having me.
Nah, dude, of course. And from me and
You know my name.
me and
Ismail.
Yeah.
Are we doing that routine? I hate it, man. Don't just say my name.
for me and the missus, this is a bit. Oh, come on. I'm sorry.
There's nothing wrong with being a Mrs. Just so.
No, nobody said that.
Yeah, you did say that, dude.
I said there's nothing wrong with it. I didn't say there's anything wrong with it.
You're just digging yourself. Just
Peace. That's just the exit. I just say peace now. No, keep it tight. Boom. That was the. Okay.